Ich habe Mary Lou McDonald.
In February 2015, a 100-year-old woman was left lying on a trolley for 24 hours in Tala Hospital. The case sparked outrage and anger, and at the time, Taoiseach, you described this incident as a truly scandalous situation. We were told this shouldn't have happened, and the cry from government was never again. In November of that same year, a 91-year-old man spent 30 hours on a hospital trolley, and your response then was that the Taoiseach and the Minister for Health must take responsibility for the ongoing crisis. Fast forward 6 years to today, on your watch as Taoiseach, and figures show that in January alone, 1,100 patients aged 75 and over were lying on trolleys for 24 hours and more. Taoiseach, you were right in 2015 when you said that one elderly patient lying on a trolley was scandalous. 1,100 elderly patients now left waiting on a trolley in a single month is 1,100 scandals, one after the other. Numbers are very clinical, numbers aren't personal, but be sure that behind every one of that 1,100 is a person. Somebody's grandfather, grandmother, mother, father, brother, sister, somebody's loved one. Taoiseach, this crisis hasn't fallen out of the sky. The INMO has been ringing the alarm bell at government for weeks and weeks. They say we face an extremely dangerous situation. In some cases, they say that this is the worst that they have ever seen. And yet, Minister Donnelly sits on his hands, and yet the HSC fails to act. On January 25th, University Hospital Limerick registered a record number of people on trolleys for a hospital for a 24-hour period. And that same day, trolley figures across the state hit a 2-year high. Yesterday, in your own neck of the woods, Cork University Hospital registered its highest number of patients recorded on trolleys since the trolley count began. So the big question that arises this morning is, what exactly is the Health Minister doing? What exactly is the HSE doing? You see, Taoiseach, you tell us that we have to pay big bucks to get big results. So Minister Donnelly is paid €225,000, Paul Reid of the HSE €412,000, Robert Watts, SecGen of the department, €298,000. And I believe when you pay that kind of money, you do expect big results. You expect that the job is done. And yet, promise after promise has been made, but we still have a crisis in GP provision. We don't have enough inpatient beds, enough community recovery beds, and the scandal of trolleys continues. Despite paying these men almost €1 million between them, the root causes of overcrowding persist. Tá ger céim taga ríis leis an plódó in our nuspedal, ní rawa é aspagani of lanúna con rialtas, cahar an ara criniú the task orsa na rinne eigandála agru. Taoiseach, do you and the Minister for Health accept responsibility for this crisis in our hospitals? Taoiseach, how is it in the midst of this extraordinary crisis that the Emergency Department Task Force has not yet met? I'm asking that you instruct the Minister that this task force meet as a matter of absolute urgency.
Could I, first of all, thank the Deputy for raising the issue and say that, without question, there have been record attendances in our emergency departments over the last month. And the situation is very, very challenging in many emergency departments across the country with those record attendances. And what is more worrying is that there's a preponderance or a majority of over 75-year-olds presenting to emergency departments with more acute illnesses than would have been the case in previous times. And the clinical and the clinicians on the ground are saying that this clearly is a legacy arising out of the COVID period in terms of people not presenting early on during COVID for obvious reasons. The lockdowns and most recently in terms of Omicron, for example, where elective procedures were de-escalated, where diagnostics were not at the same level. It's interesting, for example, in terms of cancer biopsies went down, cancer attendances went down by 15% in 2020. So what we're going to witness over the next period is delayed diagnosis coming to the fore, more acute illness, more acute cancer presentations because of people because of COVID and the legacy of COVID, not getting the earlier interventions that would have been the norm minus the pandemic. And this is a reality. And this is notwithstanding the fact that we've dramatically invested and increased home package care hours, for example. 55,000 families now benefiting. Home care package is fully funded, but there's a problem in terms of the discharge. And I think deputies would be aware of this. 50% of nursing homes and community nursing units have had COVID outbreaks right now. The regulations governing that means they cannot accept new patients for about 28 days. And we understand why that regulation was put in. Now, I understand that the Health Protection Surveillance Centre is now examining that. So that's created a problem in terms of egress from hospitals, which again is a legacy of COVID, and not just a legacy, but a present-day reality of COVID in terms of egress and people leaving hospitals once their care has been completed. Bed capacity has increased record levels in the last 12 months. Investment in health has been at record levels. I think it's gone up 6 billion since the original allocation of 2018. And a whole range of innovation has taken place. You mentioned GPs, for example. There's been huge investment in the last 2 years in the general practice GP service, particularly around chronic disease management. And particularly around GP access to diagnostics, which has made dramatic progress. 138,000 radiology scans were delivered in the community in 2021, which does reduce pressure on the acute services. But we do have to respond to this current situation in terms of pressing ahead with increased capacity, both on the acute side, but also in terms of examining that situation in terms of nursing homes and community nursing units, and also further delivery in terms of home care packages as well. Across the board, a whole range of measures have been introduced, because it's not just about one task force for 1 month of the year or 2 months of the year. It has to be a more holistic approach, system-wide, within the health service, both at the primary care side, the community care side, the acute side, and in terms of discharge provision and capacity as well. And so government is working with the HSE to make sure that we can do everything we possibly can to alleviate the pressures on emergency departments right now.
Taoiseach, in those circumstances, you and your government are failing miserably in your task, and I don't accept your excuse that this is a consequence of COVID. I mean, 20 years ago, for example, you said you would eliminate waiting lists when you were the health minister. We now have 900,000 people waiting on lists. In 2015, the Taoiseach, your partner in government and a former health minister, said that people would be waiting no longer than 18 months to see a consultant. Last month, 155,000 people were waiting longer than 18 months. And I could go on and on. See, the truth is that the failure lies in absolutely a lack of capacity. That is for sure beds, but also resources, theatre capacity, diagnostics, the list is very long. But the bigger failure, arguably, is a failure to reform. And I'm very alarmed to hear that as recently as this morning at the Health Committee, it seems that the Secretary-General of the Health Department is not signed up for sláinte care, is not signed up for the type of reform that we need. Now, I put it to you again, Taoiseach, do you accept responsibility for this situation? How is it that the Emergency Department Task Force hasn't met? I see the Minister has joined us here. Can we have an explanation for that, given the chronic situation?
Taoiseach to respond.
Do you just say anything? Did you read the Secretary-General's speech to the Dáil this morning, or to the Oireachtas Committee? Where did you pick up in that speech that he wasn't committed, that he wasn't committed to Sláintecare. The very presentations today reflect that commitment to Sláintecare. But you simply think you can come in and say anything. And it doesn't matter whether it's true or not. Just come in and say it. Throw it out there. If I throw enough mud, it will stick, seems to be your approach to what are very serious issues. And the progress report yesterday in Sláintecare shows very dramatic progress in a whole range of areas in respect and I referenced, in respect of Sláintecare, and I referenced one in terms of GP access to diagnostics, GP and the whole chronic disease management, which has resulted in about 220,000 consultations, where GPs working with consultants. There's a lot of innovation going on and a lot of implementation going on, increased in bed capacity, reduction of the GMS threshold, reduction in the medical card prescription, for example, improving access. And yes, there are challenges, and there are connections and legacies arising out of COVID, which you should accept, because that's obvious to anybody watching the situation.